Hi, and welcome to the Neuromuscular Junction with Dr. Mark Tarnopolsky. I'm here today with Kristen Bernard, who is one of our neuromuscular technicians, to demonstrate some exercises in a chair. Now, we have exercise in a chair for some of you who may be in a wheelchair and not able to ambulate, but other people, for example, if you feel a bit unsteady, doing stuff within a chair might be a good place to start. If you're standing up, you've got to have a little bit of extra balance. So we're going to go through some things that you can do for your upper body and even lower body when you're sitting in a chair. We also have patients who have a disorder called ataxia. So those of you with, for example, Friedreich's ataxia or spinocerebellar ataxia, you may have perfectly normal strength and endurance, and there's no reason why you can't exercise, but you might have to adapt it. Being in a chair like this would be a way that you could avoid some balance issues, for example, on a bike, which we'll talk about in subsequent programs. So today what we're going to do is we're going to talk about some resistance first. So there's many ways to do resistance exercise, and generally resistance exercise we're doing a stronger contraction with fewer repetitions in contrast to endurance exercise. And we've gone through some of those principles before, and now we're going to get into the practicalities. So as you've learned in the coming to terms with terms, we use things like reps and sets. A rep is one repetition. So Kristen, can you show me a repetition? Down. So that would be one repetition. So if Kristen was doing sets, then we would be doing, let's say, 3 sets of 10 repetitions. So if she were to do a repetition 10 times, that's 1, 2, and so on. So that's how we count them. So generally by the time you're getting up to a bit of fatigue in the muscle, so Kirsten, let's say we are at 12 reps, which is usually the goal we're looking for, 12 to 15 repetitions. So show me what it would look like when you're starting to get fatigued at 12 to 15 reps. So you see it's getting harder to do, and this is your final one, really hard. So you've got to be feeling it. So if, for example, in your 15th rep, it's super easy. So just show me a super easy rep. Yeah, if it's still really easy for you, you probably have to increase the weight a little bit. So what Kristen has here is a free weight. And free weights come in different sizes. How many pounds is this one?
5.
Right, so this is a 5 pound, but you can get them as low as 1 pound, 2, 3, 4, 5, all the way up to 30. Now, I don't think most of you, and including most able-bodied people, can do 30 pounds, but obviously, as you find it's getting too easy for you, and on that 3rd set, you're still finding it very easy, increase the weight a little bit, okay? So what we're doing here, we're going to go through a whole bunch of actual exercises so you can follow along subsequently, but we just want to get you sort of familiar with these terms. So what Kirsten's doing here is her bicep. So this is the bicep, that's the muscle we use to bring it up. Now with this weight, we can do other activities. We can easily just change our position a little bit to exercise a different muscle. So the bicep is the muscle here in the front. Now the deltoid is the one that lifts your arm to the side. So Kirsten, can you show me that? Good. So this is the deltoid muscle. Now you can even do the tricep, which is the muscle at the back. So this is a pushing muscle. So generally you'd have to put your arm back a little bit. And if you can show us how to do a tricep. Up, down, that's 1 rep. Good, all right, excellent. So what we're showing there is not every exercise you can do, but just some examples where you can change your body positioning to exercise different muscles. Now we're going to go through specific whole programs so you can follow along later. And one little caveat to this is that if you do have pain in your shoulders, try and keep your elbows in tight and don't get your arms up over your head. So the activity she was showing you with the triceps, for example, if you've got facioscapulohumeral muscular dystrophy, first of all, it'd be hard to get your arm up there. And if you did, because of the instability, it would potentially cause some damage to your shoulder. So we're going to talk about ways that you can be safe. So certainly calpain 3 deficiency, Pompe disease, and FSH dystrophy, you want to avoid doing activities over your head, especially with free weights. So in addition to the dumbbells that we were just talking about, there's other ways that we can do resistance activity. There's things like a kettlebell. And Kristen, can you show us the kettlebell? Yeah, so this is a kettlebell. It's very similar. It's just another way that you can do different types of activity. Usually the kettlebells would be something a little more advanced if you found that your dumbbells were a little too light for you and you wanted to try a kettlebell. You can do things like a double arm pull up. Can you just show us that? Yeah, so again, this is more for the deltoids. The nice thing here as well is that those arms are not going above your shoulder. So for FSH and those sort of disorders, you're still getting some trapezius muscles, some deltoids as well, without risking the shoulder joint as much by going over your head. So that's one way you might consider it. For some of you on the opposite side, you may be so weak that even 1 pound is too much for you. So Kristen, can you just show us without any weight in your hand what a bicep curl would look like? Now for some of you think, well, that's not exercise, but if you're very weak, if the muscle is weak, we don't want you to overstress it. So if you can't do that with no weight 15 times, then just keep going with your arm. Once you can do it 3 sets of 15 with no weight, then you start adding the weight, okay? So remember, the same thing's true. So for example, kick your knee out as far as it'll go. Good. Now, if you had something like inclusion body myopathy where the quadriceps were really weak, can you show me what an extension leg would look like? Okay, so right there, that is the maximal contraction. So you wouldn't want to add a weight to that until you could get the leg fully straight. So show me the leg fully straight. Good. Once it's there, you can then start adding some weight. But if it's everything you can to get that leg all the way out and you're completely pooped by 15 reps, then don't add a weight. But if it's really easy, of course, you would add a weight. Now, there's other ways that we can provide resistance, and one of them is a TheraBand. So I have a TheraBand in my hand here. I'm going to pass this over to Kristen. Now, with this, could you show us, how you maybe would adapt that for a bicep curl, for example? And that's 1 rep. Now, what we have here with this TheraBand is she's fixated it in her foot here. But if you're really weak and you can't push it down, of course, tie it onto something that's not going to slip. Because if your foot's not very strong, the whole thing's going to slip out of your hand. We don't want you to hurt yourself. The other thing with TheraBands as well is you can see that she's got a red one here, but these are color-coded. So for example, I have a few here. This one is yellow. And show me just how flexible the yellow one is. So this is really flexible. So this would be, sort of a 1 pound weight. And then you can move up. The green is a little bit stronger than the red. The blue is the second strongest. So show us how much harder it is using a blue for a bicep curl than it was for that yellow. Does that feel like it's more resistance?
Definitely.
Yeah. And then the next level up is the black. So you can certainly use these TheraBands, and some of them come pre-cut, other ones come in a roll, and you can just unroll it to whatever length you want. And once they start to get a little bit frayed, or if they look a little bit white, just be careful because they can break and they will eventually wear out. They're not very expensive. You can get them from drugstores, you can get them from sports stores, you can get them from the dollar store even, I think, is now selling them, certainly in Canada. And once it gets too easy for you, just move up to the next color. But I'd encourage you to start easy, get your body used to it before you start moving up. So we'll put these away. And next, what we'll show is some exercises with a ball. So we have a little ball here, cheap little ball. These are about $1 from the dollar store. And the reason we like ball exercises is for a number of muscle dystrophies, some of the limb girdles, Pompe disease in particular, we find this, and even some FSH patients. It's the adductors, which is the muscle that brings your legs together. And when the adductors are weak, it'll really affect your gait. So can you show us some adductor exercises? 1 rep, 2 reps, 3 reps. Now the other thing you can do too, just to mix it up a little bit, is you can hold what's called an isometric contraction. That means you hold a contraction for a period of time. So the first thing we were doing was, the 3 sets of 12 to 15 reps. And now let's say you're watching television, so you can get a timer on and hold it, and hold it for 30 seconds. Okay, so that would be an isometric contraction. At the cell level, the muscle's really doing the same thing, and that's going to increase your strength. And the reason why the adductors are important is that when we move our leg forward, we need these adductors to keep the leg straight. Without it, what happens is the leg goes out to the side. And for those of you who've seen somebody walk with calpain-3 deficiency or Pompe disease, you'll see that there's this sort of a movement of the legs, and that's because the adductors are weak. So whenever you see someone who's walking like this, then this type of exercise would be a good thing for you. And it's quiet. You can do it while you're watching TV. The main thing really is if you have the equipment, put it beside your television, put it in a place where you see it, where it's going to remind you to do it. Because the only exercise that's going to work is the one that you actually do, and the one that you do is going to be probably the one that's convenient and that is something that you enjoy doing. So get into the habit. It's like brushing your teeth. You know, once you're over that hump, then you'll continue to do the activity. So hopefully we've provided you with some practical examples of how to do exercises in a chair. These are the resistance exercises or strength exercises. And in a subsequent video, we're going to show you how to do more endurance type of activity when you're in a chair. And then we'll progress on to a variety of other activities. Everything that we showed you here, we're going to go through full examples of how to do it so you can follow along. And we'll have Aaron and Mila and Kristen coming back in subsequent videos to show you how to do this activity. So thanks very much for listening to us today, and hopefully you'll come back to some subsequent videos. Don't forget to subscribe and ring the bell if you have any suggestions for further videos. Thank you.